So tell us your name and what you do here, Libby, and and talk to us a little bit about leadership in the homeless sector today.
Okay, so I'm Libby Boyce. I work here at Housing for Health under Department of Health Services. I am the Director of Access, Referral, and Engagement. Housing for Health is under Health Services, and we are working towards permanently housing homeless individuals that are frequent users of our health system. And we have housed in the past 18 months or so about 1,100 people. We are looking to house a total of at least 10,000 by 2020. There's no shortage of people to be housed, so as long as we can get the resources to do so, we're gonna do that. And Department of Health Services under Dr. Mitchell Katz has been very much an advocate for the work we're doing, which makes it possible. And so he's helped us to get those resources, having taken a leap of faith that this is, he often says, and I think it's great for people to know, that if he, as a doctor, if he had a prescription pad for somebody homeless, the first thing he would write is housing. And so he has taken the leap of faith that ultimately he will reduce the cost of unnecessary hospitalization and ER usages by housing our folks that continually use our emergency services. And so that's allowed us to figure out many different ways to do that. And so it's really exciting. Previous to this work, I was the homeless coordinator for the CEO of LA County. I did that for 5 years. And prior to that, I was with Department of Health Services as the homeless coordinator prior to Dr. Katz coming down and taking such leadership in the world of homelessness and housing.
So you've seen a lot of changes in homeless services.
Oh yeah.
Years. So today, like, what do you think are the most important thing for supervisors to be thinking about in their jobs and in impacting the sector?
I think that one thing about this work, and anybody who wants to work with this patient population, is that nothing fits into a box. So, you have to really be creative, and you have to be really innovative in how you approach everybody. And, every person has a different way of reaching them. So, I think that's really important in terms of if, I was a supervisor today of case managers, for example, I would want to get as creative as possible and as the least amount of guidelines and restrictions, of course maintaining safety and boundaries and all of that, but to really work with this population. It's not your standard social work, it's not your standard case management, it's whatever it takes approach, which means a lot of different things to a lot of different people. But one thing I've definitely noticed in terms of the services that the county provides, and a lot of our community agencies are at the mercy of the county departments, because that's where their funding comes from. And I don't think we've done a good job of, meeting the needs of this population, because it's all, there's this guideline and there's this barrier, and that just doesn't work for the population. So you'll never serve the folks if you, maintain that head frame. So you have to be creative, and you have to find ways to get around systems, and I think we're creating that here at Department of Health Services. I think there's a lot of attention right now on homelessness with the new Board of Supervisor, the new 2 supervisors, and with the city, taking this huge plunge and whatever. So I think there's going to be a lot of opportunities in the future. I hope that they will bear in mind that the more guidelines, the worse service you're going to provide. So when people ask me here at DHS, like, okay, well, what is, how long can they stay, or who's eligible? Everybody's eligible, and they can stay as long as it takes. So there's no the least criteria, the least boundaries is what meets the needs of this population. So yeah.
So if somebody's seen a lot of barriers, either in a contract or with a certain agency, what do you think they should do? Who can they call?
Well, in a contract, you're kind of bound to the contract. there are creative people in the county, even the ones that run contracts, and there's ways to get technical assistance around certain issues. I mean, social service is not black and white, so I understand that there is a sector of county employees who just want to check the box, but there are definitely people who really care about the population, who can kind of help work around things. But that said, even within certain guidelines, there's a lot of things. I mean, I think historically, and this is fairly typical, it's easier to say no, because then you don't have to, it's more work to say yes. And so, so I always think about how to get to yes. And, I think that for the staff that I've supervised, it's been important to bring them along that journey. Like, okay, so what can we do? Let's think about this. And I generally have not taken no. I find a way to get
from
to
anybody.
Yes. And that I think has served me okay. So I think good leadership is innovation, creativity. It's giving your staff the tools they need. I believe very strongly that staff should be happy, that it should be an environment of laughter and productivity. And I believe that if you make it an environment of comfort and where people get along and they can say what they need to say and they feel supported, that people will be more productive. I also believe that you have to hire the right staff. And sometimes it's not about the credentials, but it's about the person. And certainly in this field, it's very much, I will tell you, here at DHS, we have amazing staff, and we go through a fairly rigorous interviewing process because we feel it's really important to have people who have strong inclinations towards working with the population, and people who have personal skills. Not necessarily, you can train them on lots of things, how to enter paperwork or whatever, but you can't change a personality. So I think that definitely takes good leadership, and that's very, very important in this field. I mean, there are people that came from the streets who are absolutely our best workers, by far better than anybody who went to USC school of social work.
Yeah,
that's just my take, and that's been my experience in social work in general. Is when you come up through the ranks and you've lived a little life, I find that those workers tend to be much more textured and flexible, and so it's just something to kind of like keep in mind.
So thinking about the future, when everything that's changing right now, like what the city just passed, what do you see for the future of homeless services? What should the supervisors and these programs be thinking about in terms of growing their programs, preparing for things that are happening? I've been doing this for a while. I feel like we, sometimes the politicians and all the masses who are trying to solve this problem sort of get hung up in all the details. And I think that it's very smart to bear in mind always that there is a solution, and that it is not that complicated. It is identifying the people you want to serve and house, having interim housing, having permanent housing, and having services. So if you break it down to like keep it simple, stupid, those are the pieces. That's the ingredients. What the volumes are, what exact types, etc. That's where you can get creative. But that's it. So you can go all around the world and talk about all the homeless at the public libraries and all the youth and all. It's the same recipe for every subpopulation for all over LA County. Same recipe. So for me, that really has helped me, and definitely in DHS, that's how we approach our work. That what we're providing is we're identifying a target population that are frequent users of our hospital system. We're putting them in interim housing whenever that's needed, and we have lots of different interim housing, and we're bringing on lots of interim housing. And we're permanently housing people, and so people stay in our interim housing till they're permanently housed by us. And and we have lots of things in our toolbox. There's not one way. There's not one, lots of different rental subsidies that we have to draw from. And there's lots of different ways to do it. If it's project-based or it's an apartment, there's lots of different services. If it's post-incarcerated, there's more of a focus on jobs and vocational and, school. And if it's somebody who's disabled, it's more on, making sure they're connected to healthcare and mental health. And I mean, it just, but it's the same recipe.
Same recipe, yeah.
So that's, for me, I think when everybody gets that, that would be a really good day. It won't happen, but, because you always have, people writing in who think they're going to solve it with some fancy new plan.
Yeah.
Or, fancy new work group.
Yeah. And it comes down
personally,
to the
I've been in it
housing.
10 years. I'm tired of that. I like that we're doing action.
Yeah.
So
Yeah.
for me, it's a beautiful thing now that I'm, coming towards the end of my career and housing people.
Yeah.
So it's nice.
It's a wonderful thing. Do you want to say anything about the Family Solution Centers or the MITs,
Ooh.
which you helped create?
I don't know. Homeless Family Solutions System. That was a project that I did when I was at the CEO's office. And that was highly charged politically. And it was a very tough year, actually. But, I believe in it. And I think, anybody who really, really knows homelessness and knows family homelessness and knows that we need to, coordinate the entry of homeless families as well as modulate what we provide to families based on their particular needs, knows that structurally it's the right system. Generally speaking, I think it's a very successful program. We were able to blend a lot of different finances. So essentially, long story short, we took the community before we did Homeless Family Solution System was a little of this, a little of that, and really no emphasis on getting families permanently housed, much more emphasis on case management and services. And so we kind of turned that on its head and made the focus getting families rehoused very quickly in a permanent setting and helping them, giving them progressive case management, meaning case management that titrates down as their needs are reduced. Because homeless families are very different than disabled homeless. It's, they may need a little bit of help for a little bit of time. And if they need a lot of help for a long time, they're going to be more somebody that we're going to direct towards permanent supportive housing. But some families just need a few months of rental subsidy and a few months of services, and then they're on their feet. So that was the really important thing about it, was that it be able to modulate depending on the needs of the family. Anyway, we got all of LA County now has this system, and there's one site in every service planning area, and it's not perfect, but I think it's it's great. We took a lot of funding and built it into the program, so it was instead of having a program for this funding and a program for this funding and a program for this funding, we made one program that makes sense, that can be volumes up and down, and put the funding together so that we could have a comprehensive program. So it makes it harder for the providers on a lot of levels, because then they're having to figure out, okay, which funding bucket to draw from. But to me, that makes a lot more sense than making the families have to figure that out, which is what was happening before. So it's like, we have a lot of responsibility as providers, and that's one of them. It's figuring out the finances so the family doesn't have to go all over LA County to get holistic care. You know what I mean? So so that's that. It's run by LASA, and a woman by the name of Johnny Miller runs that program and hopefully keeps it afloat and keeps does a lot of technical assistance. They've housed thousands of families, even since they began a year and 3 months or something. So it's a very exciting.
It's a great success.
It's a great success.
Yeah.
What was the other thing you mentioned?
The MITs, or
the
MITs.
MITs. Well, again, as the homeless coordinator, we developed a model called the single adult model, which a long story short, but where all the departments came together to think about, how to provide housing for single adults. And the MITS was a piece of that, which is multidisciplinary integrated teams, that each service planning area should have a multidisciplinary team, which includes a health provider, a mental health provider, a substance abuse provider, and some peers. And so we went to the board and have got that approved, and so that was just rolled out, I think July 1 as well, August 1st. And so every service planning area now has an agency funded through Department of Mental Health that is a multidisciplinary team that's working with street-based homeless who are really kind of isolated and severely mentally ill. And they're going to be serving 60 people a year. It's very, very intensive, and it's expected they get them housed and stay with them for 9 months using critical time intervention. That needs to be expanded, to say the least. That would be something that hopefully all the powers that be knows that we need to be doing street-based engagement. That's the identification. Remember I mentioned the 3 things: identification, interim housing, permanent housing. Mm-hmm. Identification of homeless is where that lands. And we need that, a lot of that. Because we're not going to reduce the street-based homeless unless we get out there and start engaging people where they're at. They're not coming into our clinics. That doesn't work, and that gets back to the innovation. If you're billing Medi-Cal without the waiver now, you have to do it in the clinic. Well, that doesn't work for this population. Yeah. So, these are the kinds of things we have to get really creative with.
Do you see that some of the that new potential
I have
new
no
city
idea.
money could go to it? No,
I have no idea.
Yeah,
I'm not even gonna.
Nobody knows.
And I'm not in that no anymore. I'm here housing people, which is where I want to be. So it's okay. They can handle it. I did my 5 years. So I'm done.
Right. Let Greg handle that.
Let Greg. Greg and Phil Ansell now, apparently.
Yeah. Oh, that's wonderful. Anything else that you want to share? Any message that you want to give to?
Not really. I'm happy to talk to anybody who has questions or wants to hear more. I don't know, whatever you need. I'm happy to provide whatever. And if students are interested in coming to Department of Health Services, we're always open to having students. So if anybody
like internships.
Yeah, internships.
Yeah. Wonderful.
That's it.